More than half of adults who need mental health services in our state aren't getting them, according to the Wisconsin Department of Health Services. That's even more pronounced outside major cities. Our Madeline O'Neill has more on how a University of Wisconsin-Madison program is training nurses to better serve rural communities.
In a rural setting, everybody knows everybody.
Trina Ford knows. She spent more than 20 years living and working in northern Wisconsin, for some time as a nurse practitioner.
I was back caring for patients whose primary needs were mental health.
Ford says most of the time her community didn't have the proper resources to address that.
So this was happening over and over again. And then I was reflecting back on what I want to do when I grow up, and I came to the realization that mental health is really what I want to do.
She entered a psychiatric mental health care certificate program at UW-Madison School of Nursing, which allowed her to stay working full-time in Rhinelander while learning much-needed skills to use at home.
If we only teach things from one perspective, perhaps from the city like Madison that we live in, you're losing a whole segment of our state that we're trying to serve.
A predominantly rural state in which clinical professor Gina Bryan says the majority of counties have a shortage of mental health care resources. Bryan, who runs the mental health care certificate program here at UW's nursing school, says keeping most classwork online and arranging clinical rotations outside Madison and throughout the state makes a difference.
When healthcare providers learn in communities such as rural communities, underserved areas, they fall in love with those communities and are much more likely to go back and serve in those areas. The more intimately knowledgeable providers are about the communities they're serving in, the better they can tailor services.
It's been a life changer for me.
Although she just left northern Wisconsin, Ford says she's learned when practicing mental health care, knowing your community and everybody in it can be a good thing.
So I think you can get a sense of belonging and a sense that you can make a big difference not only with those patients but within a small community.
In Madison, Madeline O'Neill, Fox 47 News at 9.
The Psychiatric Mental Health Certificate is an 18-month capstone program for licensed nurses with a master's degree. Students take one trip to Madison per month for in-person classes but can do the rest of their work remotely.